Hello, everyone. I'm Verna Collins Odom, and I am here excited to let you meet a new hidden figure for the week. She is going to be getting on here in just a few moments, but I, of course, do Podbites with Verna. I am the host of that show, and I also created the show. And the purpose of the show is to inform you, to inspire you about great things that are going on, and to also help you to ignite that thing in you to get things done. So I'm excited for you to meet our guest. I see that she has logged on. I'm going to get to her in just a second. But I also want to tell you that we take bits and pieces of people's lives and we kind of tell you about those during Pod Bites with Verna. That is our goal, to inform you about what they're doing, great things and great programs that are going on that you need to know about. As I said, season two is focused on hidden figures, people within the community who are doing great things. And our guest today is one such person. I'm actually going to try to get her into the room right now and see if she can chat with us a bit, but you are going to enjoy it here. And I'm going to add her, chat with her a bit, and just find out a little bit about her, why she's our hidden figure for the week. Let's see if she's in here with us. All right, it says it's adding. So as it's doing that, I'll go ahead and, hey, Bob, how are you? I see some folks are joining us. So glad to have you here. Thanks for joining. Hey, Billy, how are you?
Hey, how are you doing today?
I'm doing great. I am so glad you're here with us. And I just wanted to let people know that you are here as a hidden figure. Not that you're not known within your community, within your group of folks that you work with, and of course within the group of women that you service. You're very well known. But we want to let other people know outside of your discipline kind of what you're doing, what great programs are going on, and what are some of the things that we can do as we are trying to help you to grow and to help these women get the services that they need. And I haven't let everybody know what you do, so let's get to that.
Okay, that's
As I
fine.
said, as I said, Billie Hamilton Powell is right here with us. She is here to talk a little bit about herself and what's going on with her. She is actually a certified nurse midwife. She's also a registered nurse. I'm reading my notes here just to let you know because I want to get all these titles that she has right. And she holds a master's degree in physician assistant studies. And those are the things that she is involved in. You also work at a hospital and you have a relationship too with the March of Dimes. So you are doing just a lot of stuff. Thank you, Billy, for being here.
Thank you. Thank you for having me.
Yeah, so the hospital that you work with, where you do this and work with the children and the mothers and the women who need help, is University of Maryland Capital Region Medical Group. And as I said, you do what you guys call the baby bus. So let's talk a little bit about that really quickly, and then get to kind of why it's important for us to highlight this.
Absolutely, absolutely. So the Mommy Baby Bus is a grant-funded project by the March of Dimes and is supported by the University of Maryland Foundation as well. And the Mommy Baby Bus is a RV that actually provides women's health services to the community. So that is
Okay.
in Prince George's County and in Washington, D.C., serving Ward 7 and Ward 8.
Okay, so this is an on the ground service, and I saw those buses. The bus, it's incredible. I mean, you are able to service every part of a woman's health from beginning to even post baby. Once the baby comes, you're able to continue to service women that aren't able to afford this sort of help or can't get access to this kind of help.
Yeah, let me just tell you about those services. So we're expanding. So if you're from 12 years old to 102 years old, you can see a service there on the bus. So if you need GYN services, so your annual pap smear that you might need, a breast exam, birth control, those are the things that we can provide for you on an annual or what we call a as needed need. And then there are obstetrical appointments that we have. So, for example, a mom is pregnant, she needs to know where she can go to get prenatal care. She can be provided prenatal care on our bus. If she's in transition, doesn't have insurance, and say she needs to get on board with establishing insurance, she can start with us. Once she gets established in insurance, she can go what we call to the brick and mortar building. But we have a huge gap or population that we really focus on, and that is those women who do not have insurance or what we call underinsured. And that's where my services come in tremendously, is serving that gap, that population that who do not have insurance or underinsured, especially during pregnancy, their most vulnerable time.
What is the scope of the service? I know you're talking about the scope of what you offer, but how many women are we talking about? Because this is a big group that you work with. When you were at the height before COVID rolled in, when you were at the height, it was a waiting situation for some people because there is so much need. How many women would you say are we talking about who are not able? This is a big problem that aren't able to either access services. They're too far from services, and in other cases, they just can't. They have to make choices, I guess. I don't, they're not able to afford to go and maybe get a bus or maybe take some kind of transportation to the service. They need to make a choice between doing that or maybe taking care of their family. What kind of needs are we talking about?
We're actually talking about hundreds of women out there who are making that daily choice of whether or not to provide care for themselves during pregnancy or providing for their family. There are clinics out there in the area that provide what we call fee for services. So they look at your financial situation and say, hey, how much can you perform? Uh, can afford at that
Hmm.
specific time. But there is a baseline fee in which you will have to pay. Nothing out there that says it is totally, absolutely free. So a woman has to say, I've got to provide some money to get the care in at that clinic, whether it be a minimum of $500 or $1,000 to $3,000 for the total scope of practice for their OB care. Here at our services, if you want to have your whole prenatal care taken care of, you do not have to spend a penny to come into our clinic to be
Okay.
taken care of. And that's where it is. Because with the inclusion of COVID into the system, that really impacted a huge population because those who were able to say, I could afford $500 over an 8 month
Mm.
period are now saying, I don't have $500 anymore because the job that I used to have, I don't have. The extra money that we did put into that care no longer happens. That job that had insurance for me, I don't have anymore. So now I have to make that choice of do I buy food? Do I pay for insurance? Do I pay for my rent?
Hmm.
Do I go to my exams? And that's where we see this gap. So hundreds of women are making that choice. And so we're trying to lessen that choice for women by providing that care. But can we provide care for every woman who's needing that? Unfortunately, we're still not being able to provide that full scope for everybody out there because we're a small entity, but we're trying to get out there and say, hey, as many people as we can see, we are trying to provide care for.
And that's a good point when you say you're not able to do everything. I know it means the world to the ones who you can help, but obviously you cannot do everything and be everything for every woman who needs this help. So as we look at that and as we think of it, it becomes kind of a harsh thing to think about, but it's one of those things you think, is this a situation where this is a great, I don't want to call it a band-aid, but a great way to help women, but we need to get to the underlying causes. That's what I want to say. The underlying causes that will make it so that this is not a challenge as much. And of course, we can think of some of those. Obviously, there are various things that people would be able to rattle down. Some of it might be systemic, sorts of things that
Yes.
are in the system that make it so that this is not something that everybody has access to. You talk about
Right.
funding of facilities, you talk about locations of facilities. There are all sorts of things that give this funding of research for varying groups of people. So there are all sorts of things that kind of make it challenging. Is there something that needs to be done earlier? And what efforts have you seen that can be done earlier before we get into this situation where we are now, that folks have to have kind of door-to-door service because they're not able to afford to get their basic care that will keep them from being part of a medical system, forever.
I think what is happening with our state, with Maryland and not with DC, is that Maryland provides for the delivery of the baby. but it does not provide for the initial prenatal care. And so women are coming in and having a baby, but they're not having that care during the pregnancy, which can be crucial to having a successful pregnancy. So those are some of the problems I find within our system, our state governments. The other thing is that it's the paperwork that people have to establish in order to get into care. A lot of our women of color or our immigrant population that we serve are not literate. And so therefore they cannot be navigated through the system to be able to fill out the paperwork to in order to get the services. And because of that, they lack the ability to get some of the services they are entitled to.
Mm-hmm.
And so there is the need for more social service help in order to get them through the system. And then there is the 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 other avenue of in ID for some of these people. They don't have what is considered um, official identification. And
Okay.
because you don't have a official identification or what we call official uh, ways to claim income,
Mhm.
they don't feel as though they are entitled to any services and therefore are afraid to go ask for services.
And
And
it sounds
so
like you're talking in this case about the immigrant population. You're speaking of that group, the folks that might not have documentation or
yes,
the ability to
right.
say, "Hey,
My
I should get this service."
right, my Latino and African women who come in to have babies here, they don't have the documentation. They don't have the necessary documentation to say that they're citizens, or they don't have the documentation saying that they're actually making a legitimate or a uh, they're working underground pretty much
Mm.
because they don't have documentation and therefore they can't prove their financial need. And because they can't prove their financial need, they can't fill out the paperwork to qualify for some of the other programs that could financially help them during the pregnancies. And
So
so,
this could be a pretty then scary time for somebody if they have to come. They're trying to come to get help. You have the bus out for them to come, and they're not officially, let's say there's no official documentation of them. As you're saying, they're a little underground. Obviously, there are all sorts of political things that could swirl around this conversation. We're going to try to steer it toward the women and the services. How does one deal with that when you're there and you're concerned to come because you're thinking, wow, I'm going to be identified now as somebody, somebody might be watching. I'm going to be identified. How do you gain the comfort and the confidence of those people and help them? And then what are you able to do? Is there something that you can do background, to get at a table to help with these sorts of conversations and direct them? So first the women, how do you help them? And then the background, how do you get into that conversation with folks who can maybe help you on a more official end?
it took a lot of work on the ground, literally, to work with community centers, with churches, with social organizations to build that trust and a relationship with organizations that they attach to, so that we would be a friendly atmosphere and give the understanding that we are not looking for ID. We are not into reporting them for any thing of that nature. And we're not looking to claim any financial um, uh, identification or financial assistance that they would need to qualify for our services. It was just walk in, get your services. And once that barrier was cleared, then women started coming in, and then it became word of mouth. So that was a huge barrier that we had to do. And literally, it was walking to these centers, talking to these women, sitting in the waiting room, talking to them, and making sure that I was a friendly, open armed person to know, and sitting in their parking lot and saying, hey, come in here. Let's look at the services. No one's going to report you. No one's going to harass you about your ID or anything like that. And understand that you're going to be okay to get your care. And that is all that we're asking for you to do, is to get your care. And once that started being established in the communities that in which they lived in, because you can't just have them come to you. That's a key thing because they feel safe in their communities in which they live. So you go to their communities and approach them that way. That became a huge barrier that we were able to lift and be able to get to them. Then once you did that, then you also needed to bring in other social agencies that said, if I have them, can I work with you to help complete some of the things that they need to get them into these programs? Because they weren't doing it on their own because they were hitting barriers or they didn't know about these programs. So I become sort of the social agent to help them and let them understand about these programs that they can be incorporated into. So not only do I provide health, but I also provide social issues and means for them to get into social agencies that they may help them in other avenues, domestic violence, legal issues, food banks, things of that nature. Health to me doesn't mean just taking care of your pregnancy. It means taking care of the full woman and her family and making sure because if she is healthy and her family is healthy, then it makes the pregnancy or the woman's health better that way. So you have to look at that full scope.
Right. So you're talking about some social kind of service and social issues as we were talking about before. So not only are you, and again, you're not a hidden, that's what I keep saying, that this is not you're cloaked in darkness. That's not what we mean by hidden figure. What we mean is the work that you're doing, we want to bring it forward. But these women, it sounds like, are also hidden figures within the community, the ones that you serve. You talked also not just about the immigrant group, but you also talked about Black people in the community, Black women and people of
Mhm.
color. Again, with the systemic kind of concerns that people have and the social issues that we're dealing with and those sorts of programs that are needed as well. Is there a place, because you're a person who's boots on the ground, we always hear that boots on the ground, the hands and feet. Okay, that's who you are. You're with the customer, you're with the consumer. How does one backtrack this and get us to the folks who can make the change at the base level? So we're treating the women and the results of this system. How do we get back? And are you ever able to be in those kind of conversations where you're able to get back to the base level, the root of the problem, and sit and talk to people about changes that need to happen, programs that need to come into the area, research that needs to be done to help with? You talked to me a little bit about, women who end up with, diabetes and various illnesses as a result of not getting healthcare early enough. Is there a
And
place for you at the table? And are you able to get information to people who can make instrumental, fundamental changes?
And absolutely, I do that. I have had programs with the mayor of DC and working with them and letting them know about my program and saying, hey, let me be at the table so that you can understand what the impact is of my bus and saying, okay, now that I'm here, let's talk about some of these problems and issues that I am addressing and how we can better suit more better programs for not just the women on the bus, but maybe women within the DC metropolitan area. We're also working with the March of Dimes. We're collecting data and saying, okay, what are these major areas that are sort of a repetitive issue with the women here, and how with the March of Dimes we can work globally to help with women. It's not just saying, okay, we've got pregnant women and we're giving them prenatal care, but we're looking at a serious issue of diabetes and what can we do with the data that we're collecting on the unit? How can that be presented to government agencies and saying, look, this is an issue, this prematurity issue, this is what we're doing, the work that we're doing, and showing that if we interact with women early in the pregnancy, the population that we see have a high uh, uh, infant mortality rate. You see how if we introduce prenatal care early, our prematurity rates are decreasing. Our, our breastfeeding rates are increasing. Those are the things that we as a system, you as a state, you as a city would want to increase. And so therefore, if you look at my model, how I am using um, a system of of either introducing them early into the pregnancy by giving them care early uh, by being free, or
Hmm.
saying that there are places within their community now that will come to them and provide care, whether it be a mobile unit. These are the things that are going to help you decrease your morbidity and mortality rates within those systems. And so that's what I'm doing now. I'm going to city council meetings. I'm going to events that they have out there. I'm going to talking to city council people, the county legislators, bringing that data to them and saying, this is what this program is about. It's not just giving them free care, but collecting the data and showing that if we allow these women to have early initiation of prenatal care, that it
Hmm.
does make a difference. And on the other side is
Yes.
talking about the decrease in the hospital costs too.
Hmm. Hmm.
And
So an
that helps
overall
us stay.
benefit.
Oh, yeah. Oh,
So
yeah.
what are they saying when you speak to them? You go, you talk to the mayor, you talk to city councilmen, you talk to various people, which is great. What happens from there? What are they saying? What are you hearing from them? Have you seen any action? Have you seen any movement? And do the conversations continue, or is there action?
There's conversations that are continuing, especially when it comes to funding programs like this.
Mhm.
And that's what we really need, is that, do you fund more programs like this? Do you get more mobile units out there? That's what we're looking into, is that, can we get more mobile units out there to the communities? Do we expand the sites in which we go to? Right now, my focus that I'm going into is not only expanding the areas in which we're covering, but now expanding the days in which we cover. Because right now we're only doing 3 days a week, but we're showing them the need in the community, and the effect that we're having in the community. And so if the fundings are there, we're showing good outcomes, that if the funding is there, we can provide more. And
Mhm.
so that's what we're doing right now, is saying, can you provide funding for it? Because it is giving good outcomes, not only for patients to have good prenatal care, but on the end, it's serving senior hospitals as well.
Okay, so again, the goal of Podbites with Verna, this is great, is to not just inform, which you're letting us know how the buses work, how the buses roll, who comes to the bus, who's able to access the buses. We're also wanting to inspire, so encourage people to think big, to try to figure out what they want to do. A lot of people who watch Podbites with Verna are people who are in transition, so they're thinking, what can I do next? So you're needing stuff. Tell us what you need on your end. And I don't mean necessarily things that you need for, and you can talk about that too, for the bus or for the women. That's part of it. But what do you need us to do? Because you're saying you are going and you are speaking to the mayor, you're speaking to the council people, you're speaking to those folks. What do you need people to do that is an actionable item that they can try to do in their community to help with the efforts, again, with the underlying problems? Because obviously, yes, the buses are needed, but the hope is at some point that we have enough access for women and that they are feeling confident enough that they can go to a facility, they have the coverage, they have the insurance that they need. So there are a lot of systems, I mean, that have to work for that to be the case. But while we're in the place where we are now, what do you want people to do? What is the want or the get that you need from people, or the give?
I don't think many people pay attention to the prematurity rates within their locations, and understanding those rates, and looking at what the uh, the political their political actions are going on, the bills that are being raised, and what to vote on for those bills, that because those bills support the actions that I can do within those communities.
Okay.
And so we've got to be very knowledgeable about what our city council people are doing, what our delegates are doing to help, what our senators, what our congressmen, congress persons are doing to support women's health in general. And are there bills going up in front of them that say they're going to support certain entities? And if so, look at that and say, yes, I want to support it in our county. because what our taxes go towards is sometimes supporting these things.
Mhm.
And we need to be mindful that if we are spending a lot of money supporting these babies that are being um, born young, and it takes thousands and thousands of dollars to support them for days because they're born young, when I could have spent a couple of $1,000s just to give them prenatal care, that is saving so much more money that we could invest in other things like our children in school programs and things of that nature. So one of the things is being very involved in what is going on in the legislation and making sure that we're aware of what's going on there, because that trickles down on some of the programs that are affecting our county and our local hospitals.
Okay.
So that's a thing, because that's some of the things that happened in DC, and now they're having these health deserts because now they
Mhm.
they have closed down OB wards and realizing women have to travel so far to get their prenatal care. And it was like, were you watching what was going on to women out there?
Mm.
And now we have women who are suffering because it's like, oh, we closed this hospital because they weren't getting enough funding, or we felt like this wasn't a need in this community, or women were okay, they could go all the way across DC to have a birth. But they think about a woman who doesn't have a car to travel all the way from one side of DC to go all the way to another when she's in labor? How is she going to get there? And or if she has to go to a prenatal visit and she lives in Southeast and she has to go all the way, say she's over there by RFK Stadium and she has to go all the way to Georgetown, that's a long way to go
Right.
to
So the
get prenatal care.
practical, yeah, you just need information that's practical. And you're saying first thing people need to do is educate themselves. So once you're
Right,
educating yourself on the issues, find out which one of your councilmen or whoever you're voting for is in favor of things that will protect women's health. That is the start, is what you're saying. So you want folks to do that, do their homework, and you also want folks, I would imagine, to vote. Once you do your homework, then you have to vote in a way that is going to support women's health, is what you're saying.
right, exactly. And
Okay,
then and
go ahead.
then I would say another thing. It's just my own personal and women's health. I always support. It's just a side note, is the establishment of vaccines,
Mhm.
whether it be vaccines for COVID, vaccines for flu, vaccines for children. Not all of them are free, and we really should make them all free. And so that's something that we're establishing on the Mommy Baby Bus, but those are things that I think we should start looking at as well.
Okay, tell me the connection with I'm finding this interesting. So there's a connection with the vaccinations because that also will impact the mother and the baby. Is that what the connection is?
Right. ACOG statement is saying that anytime mom should have the COVID vaccine. And whether or not you're preparing for a birth or you're in a birth, the mortality rate of which women are dying or losing their babies are so high with COVID, and there is no negative outcomes from having the vaccine. The American College of Obstetrics and Gynecology are pressing to women, you need to get your COVID vaccine.
Okay. All right. Well, my goal is to get some pictures of this bus, number one, because it's incredible. When you sent me the pictures, I just was so interested in it, and to find out that there's so many women who are without care because of affordability. It's not surprising. It's just very distressing, and I think that that is something that you want to put forward to people, that there is something that we can do. And as we said, education, reading about who is voting on what in your place as your city leaders, as your state leaders, as your country leaders, where they stand, and to figure out how you want to vote to support women's health. So I think those are really important points. I know that you came out to talk today. Thank you so much for bringing this forward. We talked about
Thank you.
social issues as well that you want to see supported. We hope that people get to the table. I did want to ask you one more question, though. I meant to ask you this. As a Black woman, I meant to ask you this. What is your feeling as in being in this position? You head up this program. I don't know if I was very specific with that. You are the director of this program through your hospital and this partnership with the March of Dimes. And you're visible in that way. Of course, we're doing Hidden Figures, but very visible because this is what you do. You're heading up this bus that is everywhere in your area, trying to get this support to women who can't get it themselves. Tell me what that means to be a Black woman in that position, as far as we always talk about representation and that mattering. What do you think you bring to the role yourself, being who you are in your skin?
Um, I feel very honored to be able to do that. I feel like I could give compassionate care. I feel like women want to see women that look like them out there. And I think that that is a way of bringing them into the fold and understanding who they are. And I want them to know that it's okay. When you see people like yourself, you feel like somebody understands you. And I want them to understand that that's what I'm there for, to be understanding, to give them compassionate and complete care. That I'm not there to judge or do anything like that. I want to treat you like the woman that you are, a beautiful, deserving woman who, no matter what your status is out there, you deserve it. And that's what I give each and every woman out there. And that's how come I don't care about your financial status. I don't care about your immigrant status. That's what I tell them all. You are here to be in loving arms. And I want to make sure that I portray that out to them. And to be a woman of color out there being able to do that, I want them to see, you can be lifted up and be strong and be known that you're being taken care of by the best.
And to be at the table, tell me that one too, because I know being with the women is very inspiring to them. How about being at that table that we need you or you need to be at to help make change in these social issues that we talked about, these social justice kind of changes that need to be made that you discussed? How about being the woman that you are at that table? Do you feel welcome at that table, and are you able to make the changes that you want to make as you approach that table?
I feel very welcomed at that table. I do have to say, there have been some jobs that I did not feel welcomed at that table in my past, but where I am now, I feel very welcomed and be able to not only speak my mind, but actually be heard and be listened to.
Okay.
And so that is something that I'm very grateful for because I have so much compassion for this program and this project. I make sure people understand that passion and that need that is out there. And so I welcome people to come out there. Not only do you need to hear me talk about it, I want you to see what it's like being out there, what I'm giving out there. Come and visit the bus, see what it's like, because some people can't envision what it's like on this bus. They're like, I'm not quite sure if I want to do a visit on something that you drive. But coming out there and say, my care is just like it would be in a regular office, except for I'm giving you that extra. I'm coming to you and making you feel special by coming out to you. That's even better.
Okay, let's let people know where they can find the bus at this point.
Sure, sure. So the bus is located at 3001 Hospital Drive in Cheverly. It's there Monday and Wednesday. And then every other Friday is located at a different location in Washington, D.C. If you want to know where it's located in Washington, D.C., you can call our Mommy Baby Bus number, and they can tell you where the location would be on that Friday. So it changes on the Fridays depending on what the service need is. But for right now, it is at our Cheverly location. Due to COVID, we're sort of boxed in on where we are for the Maryland location. And then DC, we usually tell people where we're going to be on that time. Um, in addition, because of COVID, we do ask for appointments
Yeah.
for the bus. We used to be an open door where we just park and you just come on in and we just take everybody until our time is up. But because we do have to screen people, we do ask the people to have appointments before they come to the bus so that we can make sure we can screen and keep socially distant.
Okay. And you, as you said, you used to travel around. You told me to churches, to community centers, but that had to change because of COVID, but hopefully it'll get back to that point. Last couple of questions for you. Tell me what motivates you, what gets you up? Because we're talking to leaders on this show. We're talking to people who are directing things that are changing lives. And so we want to know a little bit quickly about you. What motivates you? What gets you up in the morning? What makes you excited to start your day and to do what you're called to do?
I I truly love my job, and it's a passion to me. I actually want to say that last night I had a meeting with the midwives last night, and we say that it is something, if you have to do a job for 30, 40 years, you want to make sure that it is truly in your heart. And to see helping women, you know, feel that birth growing inside of them and then finally seeing the birth of that child, or helping women understand their bodies and going through that life cycle of changes and all, and understanding those changes, and letting them understand it is okay, and teaching them that what is going on is a passion to me. And so I really feel comfortable in teaching women and saying, hey, it's okay. Let's understand our bodies. Let's understand what's going on. Really excites me each and every day. So when I wake up in the morning, it's like, hey, I get to go to work. I get to talk to women about their bodies, let them listen to your babies growing inside them. I can bring a birth, birth a baby that day. And although sometimes there can be a little sadness that goes on, I still embrace those days too, because there are some times where there is some sadness, but I have no problem saying it's okay um, to to be compassionate with them. I do cry with them sometimes, because you want to say it's okay to express those feelings. And as a provider, if I say, you know what, I feel the same way you feel, and it hurts. And to show that to them, then your patient is like, you know what, I if she feels this way, then it's okay to feel that way too. Hmm.
Yeah, my last question for you then, other than I want you to tell people your website, but give me a second on that one. My last question, what keeps you up at night? What would be a concern? So you told me the excitement, the passion that you have
Hmm.
for your job, and I've seen it because I have talked to you many times since we've been planning this interview, and you're just coming back from someplace or just going someplace and talking to the midwives and all sorts of things. So I have seen and witnessed that. What keeps you up at night? What concerns you? What would be something that, there's some problems that you can put to bed, and then there's some things that keep you up. What are those things?
The things that keep me up is not having enough people to provide care for the patients. Um, Services such as mental health. Um, we are in a crisis mode still with COVID, and you wouldn't believe how many people really need mental health and domestic violence help. And I can just not find enough help for those people that way. And I often wonder, did I give enough help for that person? Did I direct them in the right direction? So it's always, did we make the plan right? Did I give them enough help? Um, and so I wake up and say, maybe should I check on them again? And so
Mm,
I go back and I check on them again. It's 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 a constant thing of making sure that I gave enough help in the end when there is a problem. Like I said, there's sometimes where there's sadness. And so I want to make sure that I give all that help that I can give. But I also have to remember to take care of myself too.
yeah.
And that's the hardest part about it is, pulling back and saying, you got to take some time for yourself too, because you can get really engrossed in all the helping of people. It becomes, uh, a lot of hours in a day.
Oh yeah. Oh yeah, I can imagine. Well, thank you so much. Do you have a website that you can give folks so that they can get in touch or that they can find out more about the Mommy Baby Bus? And I'm going to change my headset
Right.
while you're talking about that. Go ahead.
Sure. If you want to know about the Mommy Baby Bus, you can go to umcapitalregion.org. You go to the Women's Health section, and under Community Services, there is the Mommy Baby Bus there. Our phone number there, where you can reach us, is also located there. But if you want to know the Mommy Baby Bus phone number, I'll get it for you in just a minute. The Mommy Baby phone number is 301 437 5788. And you can call that number anytime, leave a message for us, and we'll call back if you want to set up an appointment or get more information about our bus.
All right. Well, thank you. Hopefully, this will give people of how they can get involved in other areas, how they might too be able to do something that's like this. And we know that there have been services that have gone out on buses before. I was talking to somebody about that. They're like, well, I know that there are things that go out like this, but I never thought about, doing maternal care or doing women's health care. And so that is awesome. So thank you for your time. Thank you for your work. And we appreciate it. Everybody, that is it for this edition. Of course, we're going to be back here next Sunday at 4 o'clock with another hidden figure. But right now, you just heard from Billie Hamilton Powell, and she is going to be going out helping women to get the care that they need, maternal care and also women's health care. Thank you so much. All right, everybody. See you next week back here on Sunday. And don't forget, Podbites with Verna. There's a website, podbiteswithverna.com. You can go ahead and get on that and get other information. I'm hoping to get those pictures up of the bus. That's my plan, Billie, to get those up on the
Yes.
website, as well as go ahead and follow this page, follow the Podbites with Verna page, and that's going to also let you get updates as to our rest of our hidden figures that we're featuring and focusing on this month. Thanks a lot. Take care, Billie, and take care, everyone. We'll see you next week. Bye-bye.
Thank you. Bye bye.
Thank you.